Assalamu alaikum. I hope you're all doing fine. I am Dr. Muhammad Ali Rabbani, and today we are going to discuss the pectoral girdle and its muscles. I hope so. This lecture will be very interesting for you, and we will look into what are these muscles, how do they function, why they're important, and this is going to be a useful lecture whether you are into bodybuilding, anatomy, or are just curious about your body. So, pectoral girdle. So pectoral girdle is the part that connects your upper limb muscles to the skeleton of the axial skeleton. It consists of the scapula bone that is on the back of your shoulder and the clavicle bone in the front. And as you can see, the scapula does not have any bony connection with the axial skeleton except this joint. This is the this is the acromion process, this one, acromioclavicular joint, and clavicle in turn it's attached to the rest axial skeleton or sternum through this joint, sternoclavicular joint. So this is the only bony connection between the pectoral girdle and the axial skeleton. As you can see, it will not provide you with much stability that will be required. So this is enhanced by muscles, a lot of muscles present in the front, a lot of muscles present in the back, and all of these muscles, they capture and keep the pectoral girdle in place, also allow for a wide range of motions. As you can well imagine, in the absence of bony connections, the scapula is much more free to be mobile, so that is available. Muscles of the pectoral girdle. We will talk about the muscles that are attached to the pectoral girdle. They can be broadly divided as exo-appendicular muscles that connect the pectoral girdle, scapula and clavicle to the trunk, axial skeleton, and scapulohumeral muscles that connect pectoral girdle, scapula and clavicle to the upper limb. Let's talk about the exo-appendicular muscles. These muscles, they join the trunk or axial skeleton to the pectoral girdle. They can join the maybe directly joining them, meaning direct connection between the pectoral girdle and axial skeleton. And here are the muscles that are involved. So there is pectoralis minor muscle, as you can see, between ribs and the coracoid process of scapula. Subclavius muscle between the first rib and the clavicle, rhomboidus minor and rhomboidus major muscles between the scapula and the spine of vertebra, and levator scapulae muscles between the transverse process of cervical spine, transverse process of cervical vertebra and the scapula. Serratus anterior, this large muscles covering the sides of the ribs, and last but not the least, trapezius. So trapezius I will show you here. So these are the muscles. Pec minor, beneath this muscle pec minor, it is hidden by pec major in this picture. This is a picture from Natter. Subclavius again hidden. Rhomboidus major and minor on the back. These are rhomboidus minor, major and levator scapulae. Serratus anterior, latissimus dorsi, serratus anterior and trapezius. This large triangular muscle is trapezius. So these are the muscles that are, this is trapezius. They are directly connecting with the axial skeleton to the appendicular muscle, axial skeleton to the pectoral girdle. Then comes the two muscles that indirectly join the axial skeleton to the pectoral girdle, and these are pectoralis major muscle. You can see running between clavicle sternum and the humerus, and there is latissimus dorsi attaching to the lower back and through thoracolumbar fascia to the this pelvic girdle and getting attached to the humerus. Although they are not getting attached, both of these muscles are not getting attached to the pectoral girdle, meaning the clavicle and the scapula, but through their indirect connection, they are nonetheless providing support to it. So these are the exo-appendicular muscles. Pec minor, subclavius, rhomboidus, levator serratus, anterior, and trapezius, providing direct connection between girdle and axial skeleton, and pec major and latissimus dorsi, providing indirect connection through humerus. Then comes the scapulohumeral muscles. As the name indicates, these muscle joins the scapula and to the humerus. So this will include this deltoid, the muscles forming the bulk of your shoulder, this subscapularis muscle, the muscle in front of the arm, on the front of the scapula. On the back there is supraspinatus muscle, then there is infraspinatus muscle, then there is teres minor and teres major muscles. We will go into the details of these shortly, and we have already discussed these muscles attachment in the respective lectures of scapula, clavicle and humerus. So these muscles, the subscapularis, supraspinatus, infraspinatus and teres minor, these muscles together are called rotator cuff muscles. So these are the muscles. I will not be discussing these lectures in these muscles in this particular lecture. Biceps and triceps, these can be also considered as scapulohumeral muscles because one head of each of these is attached to the scapula bone. So here are pictures from letters showing subscapularis, supraspinatus, infraspinatus and teres minor. And here teres major is shown. Thank you so much for listening. I hope so this had been helpful for you. If you have any questions or feedback or suggestions regarding this lecture, please mention down in the comment, and you may reach us through our website. By the way, all the recordings with presentation material is present there, and our Facebook and YouTube channel. Please feel free to reach out. If you have any queries and suggestions, please let me know. I will be trying to follow up with further lectures on the upper limb. Thank you so much.